This is the most critical video you will ever watch about your VA disability claim. You might be just days away from your compensation and pension exam, the single most important 30 minutes that determines your financial future, and you're about to walk in there and say something that will cost you thousands of dollars a year for the rest of your life. I know this because for years, I was the one sitting on the other side of that desk, listening to veterans accidentally minimize their pain, confuse their symptoms, and hand us the exact medical evidence we needed to justify a low rating or even a denial. The VA disability system is not about how tough you are. It's about documented functional impairment. If you sound like a hero, you will be rated like one, a 0% hero. I'm going to break down the 12 specific phrases, sentences, and attitudes that I heard time and time again that tanked disability ratings, and more importantly, I'm going to tell you exactly what you need to say instead. This is coming directly from the examiner's playbook. Pay attention, because skipping even one of these could be catastrophic for your claim. Let's start with the phrase that sounds the most innocent, the most common, and the most destructive. I'm mostly fine, I just have trouble with this one thing. That phrase is lethal. When you say you are mostly fine, the examiner doesn't hear your specific complaint about your knees. They hear a global assessment of good health. They are required to document the totality of your functional capacity. If you start with mostly fine, you're establishing a baseline of high function. The VA is looking for evidence of impairment that limits your ability to work and perform activities of daily living. If you minimize your overall situation, the specific ailment you mention, be it migraines or sleep apnea, will be viewed as an isolated annoyance, not a systemic disability. The correct approach is to immediately focus on the limitations. Instead of, I'm mostly fine, you must start with, my life is severely limited by my condition, specifically regarding my ability to maintain employment and interact socially. Then you dive into the specifics, ensuring the examiner understands that even when you feel fine, the limitations are always present. The second phrase that absolutely guarantees a lower rating is, it was much worse when I was in the service, or it's much better than it used to be. This is a classic trap. While it might be true that your condition has slightly improved since the acute phase years ago, the VA rates your condition based on its current severity and the current level of impairment. By framing your condition in the past tense, stating how bad it used to be, you are implying that the current state is manageable and less debilitating. The examiner will document, veteran reports significant improvement since initial onset. That sentence alone suggests stabilization or remission, which is the opposite of what is needed for a high rating based on persistent symptoms. The VA is not compensating you for past suffering. They are compensating you for present limitations. When discussing symptoms, you must use present tense, active language focused on today. If they ask about the history, acknowledge it, but pivot immediately. While the initial injury was severe, the current chronic pain still limits my range of motion to X degrees, and I experience flare-ups that require me to stop all activity several times a week. Keep the focus right here, right now, on the pain that exists today. Next up, the third phrase, which often comes out of a sense of pride, I just pushed through it. This is the definition of a high retention mistake because it sounds commendable, but it is medically destructive to your claim. The VA examiner is not grading your character. They are documenting measurable impairment. When you say you push through, the examiner interprets that as resilience and capacity. They document that you are still able to perform the activity, even if it causes pain. The rating schedule, particularly for orthopedic conditions, is heavily dependent on painful motion and limitation of motion. If you manage to demonstrate a full range of motion during the exam, but then say you push through the pain to achieve it, the examiner will document the full range of motion and often disregard the pain component, or at least minimize its severity, because you completed the movement. You must be honest about the stopping point. If moving your arm past a certain point causes severe pain, you must stop and state, "I cannot move it further without sharp, debilitating pain." Do not demonstrate movement you cannot sustain in daily life. You are not trying to impress the examiner. You are accurately reporting your limitations. The fourth phrase is often an attempt to rationalize the condition, and it completely undermines the service connection. It's probably just old age. This is particularly common for veterans in their 40s and 50s dealing with joint issues or early onset chronic conditions. When you attribute your current symptoms, whether it's degenerative disc disease, hearing loss, or arthritis, to the natural aging process, you are essentially providing the VA with an alternative etiology, a non-service connected cause. The examiner's job is to determine if your current condition is, at least as likely as not, related to your military service. If you suggest that the issue is merely age-related wear and tear, you plant a seed of doubt that the condition meets the service connection threshold. The examiner will document your self-assessment, and the rating decision will use that as evidence to deny the service connection, claiming it is an expected progression of life, not a result of military exposure or trauma. Stick strictly to the facts. This condition started or was aggravated during my time in service, and the symptoms have persisted since my separation. Let the medical evidence connect the dots. Do not offer alternative explanations that absolve the VA of responsibility. Moving quickly to number 5, this phrase gives the examiner an easy out for rating frequency. Sometimes it hurts, or a few times a month. Vague frequency language is a trap, especially for conditions characterized by intermittent symptoms, like migraines, IBS, or mental health flare-ups. The rating criteria for many conditions are directly linked to the frequency and duration of debilitating episodes. For example, migraines are rated based on prostrating attacks that occur once a month, once every 2 months, or more often. If you use vague terms like sometimes or a few times, the examiner cannot definitively check the box that meets the threshold for the higher rating. They will default to the lowest documented frequency. You must be specific, even if it requires keeping a detailed symptom log beforehand. Instead of sometimes, say, "I experience 4 to 6 prostrating migraine attacks per month, each lasting approximately 24 hours, requiring me to lie down in a dark room." Specificity equals accuracy, and accuracy equals the proper rating. The 6th phrase is a major red flag for mental health claims, particularly PTSD. "I don't need therapy," or "I just handle it myself." While some veterans genuinely prefer alternative coping mechanisms, stating outright that you don't need or aren't seeking treatment tells the examiner that your symptoms are not severe enough to warrant ongoing professional intervention. The severity of a mental health rating, which is based on occupational and social impairment, is heavily weighted by the need for and effectiveness of treatment. If you are managing without intervention, the VA may conclude that your symptoms are mild or situational, perhaps qualifying for only a 10% or 30% rating. If you are experiencing genuine, debilitating mental health symptoms, you should be actively engaged in treatment, even if it's just monthly counseling. If you are not, you must explain why that is. Perhaps financial barriers, transportation issues, or the inability to find a suitable provider. But never imply that the lack of treatment is due to the lack of need. Your response should focus on the impact part regardless of treatment. Despite my attempts at self-management, my condition still results in severe panic attacks and isolation that prevents me from holding a steady job. Now for number 7, a phrase that minimizes the true impact of your condition by focusing on the solution. The pills handle the worst of it. This is a massive mistake, particularly with pain management, hypertension, or anxiety claims. When the VA evaluates your disability, they look at your symptoms. Before the medication is applied, However, if you tell the examiner that the medication successfully controls your symptoms, they will document that your condition is well controlled by medication. A well-controlled condition often leads to a lower rating, sometimes even 0%, because the functional impairment is effectively mitigated. Furthermore, they will look at the side effects of the medication as the new impairment, not the underlying condition itself. If the medication is truly effective, you must pivot to discuss the negative consequences of that effectiveness. Instead of saying the pills handle it, say, the medication is necessary to function, but it only reduces the pain from a 9 to a 6, and I experience severe side effects, including chronic fatigue, nausea, and emotional blunting, which further impair my ability to work. Always bring the conversation back to residual functional limitations, even if they are medication-induced. The 8th phrase is a subtle but critical error, providing legal or VA jargon and telling the examiner what rating you deserve. Phrases like, I need 50% for my back, or this meets the criteria for total disability, instantly raise a red flag. The examiner is a medical professional, not a rater. Their job is to document findings, signs, and symptoms, not to assign a percentage. When you dictate the rating you want, you come across as trying to manipulate the exam, and the examiner may become defensive or feel compelled to document findings that contradict your desired outcome to maintain objectivity. They are looking for objective medical evidence, not subjective demands. Furthermore, if you use complex VA terminology incorrectly, it suggests you're coaching yourself rather than genuinely describing your symptoms. Keep the language focused entirely on your functional impairment and pain. Never discuss percentages, compensation, or the rules of the rating schedule. Your job is to describe your pain. Their job is to document it. The rater's job is to assign the percentage. Stay in your lane. Let's talk about number 9, which is a common mistake when veterans are nervous and forget the timeline of their own medical history. I haven't had that symptom in years. This phrase directly contradicts your current claim and potentially your medical records. If you are filing a claim for a chronic condition and then you tell the examiner that a key symptom, such as night terrors related to PTSD or numbness related to radiculopathy, has been absent for a prolonged period, you are undermining the chronicity of the disability. The examiner will note that the symptom has resolved, which suggests the condition is either in remission or less severe than claimed. Even if the symptom is rare, you must describe its recurrence and severity when it does happen. If you haven't had a night terror in 6 months, but you live in constant fear of them returning, that fear is the functional impairment. Do not say it hasn't happened in years. Say, the frequency of that symptom has decreased, but when it returns, it is completely debilitating and requires intensive coping mechanisms. My daily anxiety is driven by the potential for recurrence. Always focus on the residual effects and the fear of relapse. The 10th phrase is a common display of empathy that is disastrous for your claim. My buddy has it worse than I do. Or, I know other guys who are paralyzed, so my pain isn't that bad. The VA rating system is strictly individualized. Comparing your suffering to another veteran's suffering is irrelevant and critically minimizes your own documented impairment. When you compare yourself to a more severely injured veteran, you are subtly suggesting that your symptoms are minor in comparison, which the examiner will document as veteran reports relatively minor symptoms compared to other service members. This is exactly the kind of phrasing the VA uses to justify a lower rating based on subjective minimization. Your suffering is your own, and it must be rated on its own merits. You are not responsible for rating the severity of others. When asked about the impact of your condition, focus only on your personal experience. My back pain prevents me from lifting my children sitting for more than 30 minutes and requires me to use a cane on bad days. Keep the focus strictly on the concrete limitations you face, independent of anyone else's experience. The 11th phrase is a common error of focusing on irrelevant historical details. I got injured when the Jeep rolled over on deployment in 2005. While the mechanism of injury is important for establishing service connection, dwelling on the dramatic details of the event rather than the current functional impairment wastes valuable exam time and shifts the focus away from what truly matters for the rating. The examiner is not there to write a historical narrative of your service. They are there to document your current symptoms against the rating schedule. For example, if you are claiming a knee injury, the rater needs to know your current range of motion, stability, and pain levels. They do not need a 5-minute detailed recounting of the IED blast that caused it. Once you establish the initial service connection event briefly, pivot immediately to the present. That incident resulted in a permanent injury to my shoulder. Today, the residual effects are constant sharp pain, an inability to raise my arm above my head, and instability that causes my shoulder to subluxate under load. Keep the focus on the current limitations. The past event is merely context. Finally, the 12th phrase, or more accurately, the 12th attitude to avoid, expressing anger or hostility toward the VA system or the examiner. Phrases like, "The VA screwed me over last time," or "I've been waiting 3 years for this BS," are completely counterproductive. While your frustration might be entirely justified, expressing it during the exam will not improve your rating. It will only introduce bias. The examiner is required to document your demeanor. If they document you as hostile, uncooperative, or argumentative, that documentation can be used to discredit your testimony or suggest that your mental state, if claiming a mental health condition, is volatile and resistant to examination. Remember, the examiner is a neutral party documenting findings. Treat them with professional respect, even if you distrust the system they represent. If you feel compelled to discuss past problems, frame it neutrally. My previous claim did not accurately capture the severity of my functional limitations, which is why I am seeking a clear, objective assessment today. Control your emotions. Your rating depends on it. We have covered the 12 most dangerous phrases, but understanding why they are dangerous requires a deeper dive into the mind of the VA examiner and the specific criteria used for the most complex claims. Let's expand on the concept of functional impairment, because this is the foundation of every rating decision. The VA doesn't pay you for having a diagnosis. They pay you for how that diagnosis prevents you from living a normal life. Take, for instance, phrase number 1. I'm mostly fine. When an examiner hears this regarding a claim for bilateral knee pain, they immediately jump to the CFR, the Code of Federal Regulations, specifically the sections dealing with musculoskeletal conditions. They are looking for evidence that the pain limits your gait, your ability to stand, or your capacity for prolonged ambulation. If you state you are mostly fine, the examiner interprets that as you having good functional reserve. They will document that the veteran maintains a normal gait and is able to transition from sitting to standing without assistance. Even if your knees hurt, if you perform the movement without hesitation, they document the capacity, not the pain. To counteract this, you must meticulously link every symptom to a limitation. Instead of generalities, use quantifiable impacts. My knee pain prevents me from walking more than 2 city blocks before I have to stop due to throbbing pain and instability. This means I cannot shop for groceries without assistance, and I cannot stand at my job for more than 15 minutes. The detail transforms the symptom from an annoyance into a barrier. Let's revisit phrase number 2. Minimizing current severity by focusing on the past, it's much better than it used to be. This is particularly fatal for progressive conditions like multiple sclerosis or Parkinson's or chronic pain syndromes. If the condition is progressive, the VA should be rating the current, often deteriorating state. By minimizing the current state, you risk triggering a routine future examination, RFE, or suggesting the condition has plateaued at a low severity. The examiner must document the frequency and severity of flare-ups, which are often the true measure of chronic disability. If you have chronic lower back pain, the rating often revolves around your range of motion and the number of painful flare-ups. If you say it's better than it used to be, you are discounting the current flare-ups. Instead, focus on the persistence and the unpredictability. Although I have learned coping mechanisms since the initial injury, the chronic pain remains a daily constant, and I experience completely incapacitating flare-ups 3 to 5 times a month, during which I am totally bedridden and require heavy medication. The word incapacitating is a keyword the VA rater looks for. Consider the implications of phrase number 3. I just push through it. This error is often tied to range of motion testing. If the examiner asks you to raise your arm and you stop due to pain, they measure the angle where you stopped. This is the official limitation of motion. If you push past the pain to reach a slightly higher angle, even grimacing, the VA will document the highest angle achieved, effectively ignoring the pain component. The rule is simple: if movement causes pain, stop the movement. You must be clear. That is where the pain becomes sharp and debilitating. I cannot proceed further. You are establishing the point of functional limitation. If you manage to push through the pain in the exam, the VA has documented your capacity to perform that motion, regardless of the discomfort. Remember the concept of painful motion. The VA schedule states that if motion is painful, the rating must be given at the level of the limitation before the pain begins, or at least the pain must be documented as a significant factor. But if you complete the motion, they often prioritize the measurable angle. Now, let's drill down into the mental health context, specifically phrase number 6. I don't need therapy. The VA uses the general rating formula for mental disorders, which is heavily reliant on the presence of symptoms and the resulting impairment in occupational and social settings. The highest ratings, 70% and 100%, require symptoms that are near constant and severely debilitating. If you are not in treatment, the VA assumes that the functional impairment is not severe enough to necessitate professional intervention. To counter this, if you genuinely cannot access or tolerate traditional therapy, you must explain the reason for the avoidance, linking it back to the disability itself. For example, if you have severe social anxiety or paranoia related to PTSD, you might say, my symptoms of hypervigilance and mistrust make it impossible for me to form a therapeutic relationship, leading to isolation. I attempted therapy X times, but the overwhelming anxiety associated with leaving the house and speaking to strangers resulted in increased panic attacks and avoidance. This shifts the narrative from I don't need it to my disability prevents me from utilizing it, which is an impairment in itself. Let's revisit the danger of phrase number 7, focusing on medication effectiveness. The pills handle the worst of it. This is crucial for hypertension and other conditions managed by maintenance drugs. If your blood pressure is controlled by medication, your rating for hypertension will be lower, likely 0% or 10%. However, the VA must consider the side effects of that medication. If you are taking medication for anxiety and it makes you perpetually drowsy, that drowsiness is a new, rateable impairment under the umbrella of your service-connected condition. When discussing medication, you must separate the benefit from the cost. The medication lowers my blood pressure to a manageable range, which is necessary. However, the severe chronic fatigue and persistent dizziness caused by the medication prevent me from driving long distances or maintaining focus at work. You are providing the VA with a new avenue for compensation, the impairment caused by the necessary treatment. The mistake in phrase number 8 Demanding a specific percentage is not just about being polite, it's about maintaining the integrity of the medical exam. The examiner is tasked with filling out a Disability Benefits Questionnaire, DBQ. The DBQ is a checklist of symptoms, signs, and functional limitations. If you spend time arguing about the percentage, you are distracting the examiner from accurately documenting the findings on the DBQ. The rater will assign the percentage based on the data provided in the DBQ, not on your subjective demand. If you interrupt the flow of the exam with demands, the examiner might rush or miss critical documentation. Points. Remember, the DBQ is your report card. Ensure the examiner documents every single required field, focusing on frequency, severity, and functional loss. Let's expand on the concept of vague language, which was covered in phrase number 5. Sometimes it hurts. This is particularly damaging for conditions that fluctuate, such as rheumatoid arthritis or IBD. The VA schedule requires documentation of exacerbations. If your symptoms are inconsistent, you must use language that emphasizes the total days lost to the condition. Instead of sometimes, quantify the time lost. Over the past 90 days, my IBD symptoms caused me to miss 15 total days of work due to debilitating abdominal pain, and on the days I did attend work, I had to take extended unscheduled breaks. The VA looks for a pattern of interference with employment. If you cannot quantify the loss, the VA assumes the interference is negligible. If you don't track it, they can't rate it. The error in phrase number 11, dwelling on the historical event, is often a failure to translate trauma into present-day disability. For PTSD claims, the service connection is often straightforward. The event happened. But the rating is based on the current manifestation of symptoms, chronic sleep disturbance, relationship issues, occupational impairment, panic attacks, etc. If you spend 80% of the exam discussing the firefight and 20% discussing your current inability to hold a job, the examiner will have insufficient data to justify a high rating based on occupational and social impairment. You must invert that ratio. Once the examiner confirms the stressor event, immediately pivot to the current symptomology. Since that event, I have been unable to tolerate crowded places. I suffer from severe insomnia, requiring me to take 4 hours to fall asleep, and I frequently lash out at my family, leading to severe marital strain. Focus on the here and now, the measurable impact on your life. To tie this all together, the purpose of the C&P exam is not to prove you were injured. It is to prove you are currently disabled by that injury. Every word you speak must serve the goal of linking your current symptoms to a measurable functional loss that aligns with the CFR rating schedule. Before you walk into that room, remember these final critical rules derived from the 12 phrases we discussed. First, always prioritize the negative. The VA is looking for impairment. If you can walk 3 miles, but the last 2 miles cause excruciating pain, you must focus on the excruciating pain and the need to stop. Do not focus on the first mile you managed to walk easily. Second, use precise, active vocabulary. Replace weak words like bad or hard with clinical terms like debilitating, incapacitating, prostrating, unpredictable, and unrelenting. These words are markers for the rater. Third, ensure the examiner documents your inability to work. Even if you are currently employed, if you are working in a highly modified environment, or if your condition limits the type of work you can do, you must state that. I am only able to maintain this job because my boss allows me to take frequent breaks and work from home, which is not sustainable in a normal work environment. This establishes occupational impairment. The VA system is complex, and it is designed to be objective. Your job is to provide objective data, the limitations, even if they are delivered subjectively through your testimony. Avoid the 12 phrases that minimize your suffering. Focus solely on your current. measurable limitations, and you will significantly increase your chances of getting the rating you earned and deserve. Do not be a hero in that exam room. Be honest, be specific, and document your disability. This is your life and your future financial stability. Take control of the narrative right now.